Welcome amazing people to this amazing presentation. For those who are new or beginners, ensure that you subscribe and click the bell so that you can be notified whenever there's a new video on Orthoflix, or you can be notified whatever is going down here on Orthoflix. So my name is Dr. Harry, and today I'm going to talk about olecranon bursitis. What should you know about olecranon bursitis? Stay around, stick around. There's much that you will learn. Never disappointing. Thank you. If you have had a blow to one of your elbows or spend a lot of time leaning on them, you could see the tip of the joint getting red or swollen. In severe cases of swelling, a lump could form, jutting out from the tip, kind of like the cartoon character Popeye. That's why olecranon bursitis is sometimes called Popeye's elbow. The olecranon refers to your pointy bone in your elbow. Bursitis refers to inflammation of part of your body called the bursa. A bursa is a sac full of fluid. Bursa occurs through your body, acting as a cushion between the body parts, such as where muscles and tendons glide over bones and near large joints such as your shoulder, hips, and knees. So the bursa in your elbow is called the olecranon bursa. Reduces friction between the skin and the pointy bone in your elbow, the olecranon, which you can feel when you bend it. So you do not notice the bursa because it usually lies flat, conforming to the shape of the bone. But when it gets irritated, the bursa can get swollen and large. What causes olecranon bursitis? Your elbow can start swelling for several reasons. Trauma. A hard blow to the elbow, such as hitting or falling on top of it, could cause the bursa to swell. Too much pressure leaning on your elbow against a hard surface over a long time can irritate the bursa. Plumbers, air conditioning technicians, and others who have to work on their elbows are more likely to get the condition. The conditions. If you have another condition, such as rheumatoid arthritis, a disease where your immune system attacks your joints, gout arthritis, a type of arthritis, or even kidney failure in which you may need dialysis, your blood is filtered through a machine, you are at a higher risk of getting Popeye's elbow. Infection. If your bursa is infected from a cut, scrap, or insect bite, this will cause the sac to fill up with extra fluid, which may eventually make it to swell or even get red. So what are the symptoms? You may see some of these symptoms when you have an elbow bursitis. So swelling is the first symptom. This is usually the first symptom. You will notice the skin of the elbow or at the back of the elbow getting loose. You may not see the swelling at first. In some cases, the swelling flares up quickly and you might notice it right away. As the swelling gets bigger, it can look like a golf ball at the tip of your elbow. Pain is another symptom. As the bursa stretches, this can start causing pain in your elbow, especially when you bend them. There's usually no pain when the elbow is extended, but some people with elbow bursitis don't feel any pain, whether the elbow is flexed or extended. Or warm. If you see this in the area around your elbow, you might have an infected bursa. Tenderness is another sign. Another sign is sensitivity in and around the elbow. Pus. Watch for a yellow or white, thick, cloudy fluid draining from an infected bursa. Diagnosis. Discuss the symptoms and medical history with your doctor. Your doctor will examine your arm and elbow. In some cases, he or she may suggest x-rays, which looks to see whether a broken bone or a piece of bony growth called a spur, a bone spur, is causing the elbow to swell. She could also order for a blood test to see whether you have an infection. But this is not usually helpful. Your doctor may take a sample of the fluid from your bursa. This will be done using a needle. The fluid testing is taken to the lab for further testing. If the fluid is sparse, this means you may have an infection. Treatment is all about easing your discomfort and taking steps to prevent or cure infection. If your elbow bursa is not infected, take the following steps. Protect your elbow. This could mean wearing elbow pads or a wrap to cushion it. Avoid activities that put direct pressure on your elbow or affected elbow. Take pain medicines such as Iboprofen or other anti-inflammatory to reduce the swelling and the pain. Follow your doctor's directions and read the medicine label carefully. If you may have olecranon bursitis because of an infection, you may have to take antibiotics that your doctor prescribes. Take the medicine as directed to fight the infection. If you don't see improvements in pain, in swelling in your elbow after taking this medication for 3 to 4 weeks, let your doctor know. He or she may suggest draining the fluid from your bursa and injecting a medicine to reduce swelling. An injection of corticosteroids, a medication commonly used to reduce inflammation and redness, may be used to lessen pain and swelling. If your elbow bursitis isn't getting better despite medicine and treatment, your doctor may recommend surgery. Depending on your case, the entire bursa may be removed. The bursa usually grows back normally after several months, so you typically need about 3 to 4 weeks to regain full use of your elbow after surgery. Thanks for staying around. I hope you learned something. Next time you see a swelling in your elbow or signs and symptoms of olecranon bursitis, ensure to seek medical attention or check up with your doctor. Thank you.